Prime Minister has announced the most drastic limits to our lives that the UK has ever seen in living memory. The aim, he says, is to save lives in this time of national emergency. Without a huge national effort, Mr Johnson has made it clear there will come a moment when the NHS will not be able to cope and more people will die. From tonight, you can only leave your home for very specific reasons. They are to shop for basic necessities such as food and medicine. You can go outside for only one form of exercise a day, alone or with members of your household. All gatherings of more than 2 people are banned, excluding your family. You can leave home for any medical need or to care for a vulnerable person. And finally, you can travel to and from work, but only where absolutely necessary and if you cannot work from home. These new restrictions can be enforced by the police, including using fines. Today, 335 people are confirmed to have died from coronavirus. That's 6 times more than this time last week. Our political editor, Laura Kuenssberg, joins us live from Westminster. And Laura, we're all just taking these huge changes in, but the Prime Minister clearly felt he had no other option tonight.
That's right, Fiona. None of us have ever heard a message like it. No politician alive could ever have imagined delivering it. And that's because the coronavirus crisis is a situation that the country has simply never faced anything like in living memory. And that's why Boris Johnson tonight described this as a moment of national emergency. The coronavirus crisis is hitting home. The clock starts on a new phase. Big Ben keeping time on an era none of us could have imagined. Inside at a desk in Downing Street, an admission to every one of us outside.
Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. So it's vital to slow the spread of the disease.
No longer just advice on how to battle the virus, but a demand from Number 10.
From this evening, I must give the British people a very simple instruction. You must stay at home. Because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings.
This isn't only an emergency for our hospital wards, but for the country. So all shops must shut unless they sell necessities. All gatherings of more than 2 people banned. The measures will be reviewed in 3 weeks, but...
No Prime Minister wants to enact measures like this. But at present, there are just no easy options. The way ahead is hard, and it is still true that many lives will, sadly, be lost. And yet it is also true that there is a clear way through. In this fight, we can be in no doubt that each and every one of us is directly enlisted. Each and every one of us is now obliged to join together to halt the spread of this disease, to protect our NHS and to save many, many thousands of lives. And I know that as they have in the past, so many times, the people of this country will rise to that challenge and we will come through it stronger than ever. We will beat the coronavirus, and we will beat it together. And therefore, I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives.
Labour had been calling from today for a firmer hand.
We do need to understand how they'll be enforced. We do need to understand the details of who can actually travel to work and who can't travel to work. People are frightened. People are concerned. People just want certainty and clarity.
Well, countries across Europe continue to be engulfed by the coronavirus pandemic, despite restrictions being ramped up. Thousands of army reservists have been called up in Switzerland to relieve hospitals under pressure as the number of people testing positive for coronavirus jumped by 15% in 24 hours. It's now more than 8,500. Spain has again registered its highest daily death toll of people from the virus. 462 have died in the past day. The Deputy Prime Minister, Carmen Calvo, is being tested in hospital. In Italy, there is some good news. The rate of infection has dropped for the second day in a row, but it's still Europe's worst affected country. 6,078 people have now died, with 602 deaths in the last day. In a moment, we'll hear from Mark Lowen in Italy, but first, Damien Grammaticus reports from the Spanish capital, Madrid.
Listen to the coughing from virus patients sprawled in the corridors of a Madrid hospital. This is a health service starting to be swamped. Inside another hospital, Spain's capital is the epicenter of this country's outbreak. Medical staff say this is just the beginning. Cases are expected to keep rising for days yet.
Está empezando.
So they're making desperate appeals.
Muy gordo. No hay camas. No.
We don't have beds, ventilators, staff, protective equipment.
Dejar de trabajar después de
I'm just finishing a 10-hour shift.
con esta cara y con lágrimas.
Look at me. Look at my tears.
Por favor,
Please, stay at home.
quédate en tu casa. Tú que puedes.
We watch today a constant flow of new arrivals, ambulance after ambulance. Every time it means hospital staff are being exposed themselves. And healthcare professionals really are making extraordinary sacrifices here. More than 1 in 10 of all confirmed infections in Spain now are amongst doctors, nurses and other health workers. Maria Aliano is an anaesthetist in isolation after testing positive. Her symptoms have been mild, but also infected have been her boyfriend and baby. Things are so dire, Maria is waiting for a new test and the all clear. Her hospital needs her.
If I'm negative, I will go to work. Yeah,
Right, so straight back into the hospital.
straight back to the work because now things are dramatic here in Madrid.
So dramatic, she says, doctors are now having to prioritise. The young get ventilators before the old.
First, you need to take care of the young people, of course, very old people who are not going to recover from this case of disease. Well, you help them not to suffer, but probably they won't go to the critical care unit.
In one of those units, doctors remove a breathing tube. And the patient recovering takes their first breaths unaided. A moment of triumph, the reward for all the risk the medics have taken.
Tightening the screw on people and the virus. 2 weeks into a nationwide lockdown, the measures are toughening again. Italians now banned from leaving their town and travelling across the country. Not since wartime curfews have these scenes played out.
Well, the limits on movement are being stepped up with ever more police spot checks to see if people can justify why they're out. And yet polls suggest that most Italians would support even tighter restrictions. There is virtually no sense of rebellion or complacency here.
Now to the coronavirus pandemic, and the World Health Organization says it is accelerating around the globe. South Africa has announced it will put troops on the streets to enforce a strict lockdown for 3 weeks starting on Thursday night. President Cyril Ramaphosa said the alternative was a human catastrophe. The country has the highest number of cases in Africa, with 402 cases, Our Africa correspondent Andrew Harding is in Johannesburg for us this evening. So Andrew, a relatively limited number of confirmed cases and no deaths, but the government determined to clamp down early. I'm sorry, I thought we might just get Andrew there at the last moment, but I'm afraid we haven't. We'll try and come back to him later if we can. The Iranian government is strongly advising people not to travel within the country as people are still celebrating the Persian New Year, or Nowruz. Iran is struggling to contain one of the biggest outbreaks outside China, with one person dying from the disease every 10 minutes. More than 1,800 people are confirmed to have died. Rana Rahimpour reports.